I'm Patricia and I'm going to talk the first article. So in Article 1 is discussed how IT has benefited most patients and healthcare professionals in delivering high quality healthcare. In fact, the result shows that 88% of the study shows positive impact on patient behavior and 82% reported high levels of improvement in patient engagement. Indeed, the revolution of healthcare technology is increasing and assisting individuals to better health outcomes. As the article mentioned, using internet-based weight loss program was correlated to a huge increase in weight loss. This shows the effectiveness of technology in today's modern era. In my opinion, I think technology does make things more effective and efficient, especially with the development of EHR. There is a decrease in human errors and less time spent looking for patients' health record. However, IT also has its downfalls, which will be discussed by my fellow team members. Thank you.
Hi, I'm going to be giving a summary and a commentary on Article 1, the impact of technology on patient engagement and health behavior change, a systematic review of the literature. Patient engagement is a key to avoiding certain outcomes of disease and death, but face-to-face patient-to-doctor interaction is limited, reaching only a fraction of the population. Is information technology a successful methodology to reaching out to broader ranges of the population? IT platforms are being used in numerous ways in order to achieve the goal of increasing patient engagement in their personal health care. Are these platforms effective in achieving their goals? This vital information is determining why certain interventions succeed or fail. Salvesi et al. Find that IT platforms do in fact improve health behavior across different disease categories across the world. These intervention methods have been viewed as a positive health behavior change in patients, providing them with extra help and counseling associated with questions and concerns regarding their data, as well as improving their lifestyle choices and overall health. My opinion on this matter is that as a person who has access to the internet, mobile phones, social media, etc., health apps and programs would be beneficial for me to keep track of anything ranging from amount of consumption to the amount of physical exercise I do, therefore benefiting my health behavior. But what about the people who really need the medical aid and tracking, such as the homeless population, for instance, who have no access to IT software and cannot benefit from these health benefiting programs? How can we expand the IT platforms to benefit a broader portion of the community, including the homeless population? Thank you.
Hi everyone, I'm Audrey. I'm gonna take the next couple slides to talk about types of IT platforms and real-world relevance.
What constitutes an IT platform for patient engagement and health behavior management? Applications that send reminders about medications, online surveys for particular patient groups, and direct contact with healthcare professionals. All of these multimodal platforms are transforming the healthcare field today. Not only are patients more involved and invested in their personal health, but providers also get an exclusive look at day-to-day feelings, symptoms, and activities of their patients, which overall can make their diagnoses and recommendations stronger. However, we can't rule out things like recall and reporting bias, or the fact that the everyday person lacks expertise in the medical field. But we can see that allowing individuals to invest in their health and have a hand in their healthcare management brings about positive change in public health behaviors. Innovation in medical informatics will continue to influence the way that patient care is handled.
Hello, I'll be going over the second article that we were assigned, which was dealing with the technology in Professor Michelle Kine's lab, which delves into the use of Shrinky Dinks as a means of transport for sensors. Now, this idea came up because her child was put into the neonatal ICU and hooked up to a whole bunch of sensors, but the sensors didn't actually tell her anything. They were just there for show, as she briefly summarizes in her quote in the article. So that's the inspiration behind this whole project of creating high fidelity respiration monitors that are relatively cheap so that they can detect asthma and other pulmonary conditions using inexpensive sensors so that it can be accessible to everyone. That's something that I do agree with entirely, that making affordable options for people to have medical treatment is something that we should be striving for, and using Shrinky Dinks as a means to do that is something that's very vital.
Can you imagine using Shrinky Dinks as a platform for medical applications? The relatively cheap plastic is used in Michelle Kine's lab to measure respiratory readings. When I think of medical devices, I don't think of cheap children's toys, but rather expensive materials and high cost. This is wonderful that engineers are able to take something that's low cost and abundant to solve for a problem that's, expensive. They are inexpensive, disposable, and they can be used with convenience. This takes us to the next level of medical informatics, one where you don't have to be a trained specialist in order to be able to solve problems. And this breakthrough shows that technology is allowing a lot more people to contribute to help solve medical problems than ever before. And I think it's great that we are inventing new ways to approach problems. I'm pretty sure that, our values go up and our costs go down. It takes us less time, and thus it allows us to spend more time working on different problems that need attention. So that's great.